affects cell wall synthesis. I'm going to start with, where'd it go? Where'd it go? Great. Vancomycin. And pick up from where we had left off with our monobactums. So, vancomycin affects the cell wall of gram-positive bacterium. Vancomycin is typically used in an IV form, very, very strong medication. A lot of times we may use it with methicillin-resistant staphylococcus, and I have seen it used or heard of it used. I've never actually used it myself in a pill form for severe cases of C. diff and things of that nature. Again, this is a drug they try to limit the usage of because we don't want to have drug resistance, excuse me, drug resistance to increase. However, we do have some drug resistance staphylococci of vancomycin, which is not a very good thing because we don't have a whole lot of other options. This is a drug of last resort. Why? Because of the serious side effects that will be that will occur or can occur when using this medication, such as kidney damage, hearing damage, and things of that nature. Now, antibiotics that will affect the cell membrane, one of which is bacitracin. We already mentioned bacitracin a moment ago. It is extracted from a bacterium known as Bacillus subtilis. It is toxic internally, like I said before, so you don't want to ingest it. It is toxic to your kidneys, can cause kidney damage. It's great for gram-positive bacterium infections that are on from wound infections, so topicals. We use this as a topical. Sometimes some people are allergic to bacitracin. You may have seen bacitracin by itself as a topical, but also you'll see it with neosporin mixed with polymyxin as well as neomycin to create neosporin, our triple antibiotic that's so common. Polymyxin is also effective against gram-negative bacterium. Again, a drug that will affect the cell membrane of a microbe. Antibiotics that will affect protein synthesis, one of which is the aminoglycoside class. This one will block messenger RNA. So RNA synthesis, it will shut down or reduce. This one is injection, intramuscular, one of which is streptomycin. We use this for tuberculosis sometimes. Another is gentamicin. Again, these are pretty serious. Gentamicin, kidney and hearing damage can occur using gentamicin. Chloramphenicol is another one, very good for gram-positive, gram-negative bacteria, as well as rickettsia and fungi. So this is a very broad spectrum drug. Drug of choice for treating typhoid fever. This one has a very serious side effect that we want to make sure to mention of aplastic anemia. It can be fatal. What happens with aplastic anemia is it actually suppresses the bone marrow activity. If you haven't already taken A&P, we do mention aplastic anemia. It's very serious. Tetracyclines, our next one, that also inhibits protein synthesis. They're very bacteriostatic. They decrease the number of microbes. They reduce their number. Doxycycline, minocycline, those are your most common semi-synthetic tetracyclines that help in resistance to bacterium. They're oral. They can lead to teeth discoloration that's shown in your textbook on page 302. This is figure 10.14, some side effects resulting from toxicity of antimicrobial agents. And the teeth discoloration is showing what tetracyclines can do with overuse. You have to be careful with using them with any sort of vitamins or food, things of that nature, because they tend to bind to calcium and get stored and deposited in teeth and other bones. So you have to be careful with that, especially with children, because we notice stunted bone growth in children when using this excessively. Also, it may reduce the normal flora in your gut and things of that nature, so you have to be very aware of that. It's very active against a good number of bacteria. That's why we like to use it so much, and it's very common to use in acne treatments. Next class would be macrolides. This is a very broad spectrum bacteriostatic antimicrobial. This is driving me nuts. These are going to, of course, reduce the numbers of bacterium. Erythromycin is a very common macrolide. We use it for a number of different things. Treating atypical pneumonia and Legionnaire's disease is two of such things. Very effective against gram-positive bacteria. It does have some side effects. One of the most common macrolides and one of the best-selling antibiotics today is Zithromax. The drug is azithromycin, and also we know this now as Z-Pax. They're both semi-synthetic, very broad spectrum antibiotics. Another one is let me slow down. Another class is lincosamides. In this group or class, we would have clindamycin. Again, this is comes from the bacterium Streptomyces. We derive it from. Very useful drug. We have to be careful because it's limited serious infections because it's such a strong drug. If we're not careful, it'll kill all the normal flora, and C. diff can be a problem. Oxazolidinones is the next class. This is a nice big group of antibiotics that is fairly new. Linezolid is in this group, very effective in treating MRSA. However, it is toxic to mitochondria, so it kills off our mitochondria and can be a huge problem in that field, or I should say in that aspect. That's the word I'm looking for, in that aspect. Antibiotics that inhibit nucleic acid synthesis. This one, we're going to look at rifampin. Rifampin is very strong. This one, I knew I'd remember which one it was. I'd have to go through all the different aspects, the different ones. Rifampin turns body fluids orange and can cause liver damage. So therefore, your urine turns orange whenever you take rifampin. Great to be treated with for tuberculosis and leprosy, so the Mycobacterium species. When we add isoniazid and butol to the number of drugs that we would use. Now, I'm not going to look at these antifungals in here because, again, I don't focus on those until we get to the actual bacterium, the fungus and virus sections. However, MRSA is very important to know. We've already mentioned MRSA. There are certain types of bacterium that are resistant, so we have to use other treatments. VRSA is your vancomycin-resistant Staphylococcus aureus. Again, if they're resistant to vancomycin, we have to use even more stricter things. This right here, once you get past this point, this is my bacterium section. When we get to bacteria next week, I will be covering the different bacterium. Then that's just starting that one page, so just ignore that. And we are done with our section here. Now, I mentioned to you earlier about going through the chart and making sure you create the antimicrobial chart. If you guys have any questions about that, please send me something. Let me know, and that way I can make a clarification through announcements and so forth of anything that I wasn't clear enough about when I was talking about it in the first place. Unfortunately, we can't sit down and say, hey, and just chat back and forth unless we have a chat session, which is fine as well. And I'll also talk to you guys a little bit more about how you can speak with each other and chat back and forth and do some conferencing if you have time. I know some of you are really strapped with your jobs currently because they're putting a lot more demands on some of you. Some of you may have, there's your kids are at home now. There's a lot of different things going on, so I want to make sure you guys are going to be as successful as you can. And if you have any questions, just let me know.